So I think that the progression-free survival is an interesting endpoint in this trial. They were very close, however, in their actual median progression-free survivals. But what was very important was the actual hazard ratio and the overall shape of the curves, which did suggest that there was actually a distinction as we progress further along in their treatment time. So we've seen this with other trials. So sometimes we'll actually see a median progression-free survival or median result, which is close to significance or perhaps not even significant. And yet, when you look at the entire population and the entire duration of the trial, you can actually start to tease out differences. So I personally believe that the overall hazard ratio is a much better indicator of how the trial is performing. We don't know for sure, and this is a subject of a lot of discussion, a lot of debate. It may very well be that once we get to the median, we're actually seeing a distinct population difference between the two groups of patients, and perhaps that is where we're seeing the distinction in the activity differences between the two drugs. I do feel that it would be reasonable to perhaps try to analyze what those differences might be from the groups of patients who actually managed to have a longer progression-free survival to see if we can actually see what those differences are. But we don't really know the answer. So the take-home message that I have is that when you compare them head-to-head, there seems to be an advantage of one drug versus the other. And in this case, afatinib appeared to have better response rates, better time to treatment failure, and a better progression-free survival. What will be really important to see is whether this translates into overall survival advantages. And I would like to also see a little bit more information on quality of life as well. That's a very good question. So my practice won't change very much. I do tend to use afatinib more often than I use gefitinib. And that's primarily because I'm comfortable with the adverse event profile, dose reductions, and being able to manage the side effects of the drug to obtain what I believe is getting perhaps a better efficacy, especially in the deletion 19 patients. However, there are certainly individuals across Canada that don't feel the same way, that they're concerned about some of the adverse events. So I think some of the information here that was presented that shows that the adverse event profile is manageable and that the benefits are maintained even with dose reductions, that might lead to a change in some other clinicians' practices.